Hi, this is Dr. Paul Angelchik. Today is April 16th, 2009, and this is our second video blog that we've started doing on our website. If you want to give us feedback about the video blogs, you can email us at info@drangelchik.com. That's doctor spelled out DoctorAngelchik.com. Today I wanted to talk first about how to choose a plastic surgeon. You have a lot of choices when you're thinking about cosmetic surgery, and some choices might be better than others. The following are sort of my top 10 things to look for. These are my opinions. It's not necessarily the same for everybody, but I think if you follow these guidelines, that more likely than not you'll end up with a qualified surgeon who will do a good job for you. The first thing is your surgeon should be board certified in plastic surgery by the American Board of Plastic Surgery, and typically those surgeons are also going to be members of the American Society of Plastic Surgeons. That basically means that your surgeon has completed a residency specifically in plastic surgery and usually has at least 6 years of surgical training. Most of us have more than that. There are other people doing plastic surgery who have not done plastic surgery residencies and who may actually have a board certification from another entity. There are people in my community, for example, who are family practitioners or obstetricians or orthopedic surgeons, all of whom have cosmetic surgery practices, but who never did a plastic surgery residency. And the analogy that I would use is that, if you're going to go as a passenger on a 747, you want to have the pilot who trained on the 747, not the guy who's flying a Cessna and takes a weekend course. So that's kind of how I look at it. But because of state statutes, anybody with a medical license basically can do just about anything within the scope of medical practice if they can find a place to do it. Which brings me to my second point, which is your surgeon should have credentials at hospitals and or surgery centers to do the procedures that you're interested in. If a surgeon doesn't have credentials at those areas and just does in those locations rather, and just does this in his office, that can be a sign that they haven't necessarily done adequate training in those procedures and that they couldn't get credentials at those facilities. Does your surgeon have experience in your area of interest, and what is his or her recent experience? You want to have somebody who has a lot of experience in the areas that you're considering and has been doing it recently, and you can find this out just by asking your surgeon how many of these does he do every year or how many has he done, and you should be able to get a gauge from that question. azmd.gov is the Arizona Medical Board website. On there you can find information about doctors, MDs specifically. There's also a DO website who had any type of disciplinary action. And if somebody has had serious disciplinary infractions or recurrent infractions, that's probably a sign that you may want to look elsewhere. When you meet with your surgeon at consultation, you should be able to get detailed information about the procedure, pros and cons of the procedure, alternatives to the procedure that you're thinking of and the pros and cons of those, and you should get answers to all your questions. Additionally, you should get realistic expectations about what can be achieved, because plastic surgery can help you look better or look different, but it can't solve other types of issues, and your surgeon should be able to help guide you in terms of what you can realistically expect from your procedure. When you go to your consultation, you should meet with your doctor, not just with a patient coordinator. There are practices that I'm aware of where patients never see their surgeon until the day of surgery. As a consumer, I find that hard to understand. As a surgeon, I find that hard to understand as well. I think you have to achieve a level of comfort with the doctor before you go in and decide that he's going to be doing that surgery on you. You shouldn't have high-pressure sales techniques forced on you at your visit. The economy is not so great these days. There's more pressure on everybody to sell procedures, but you should have a low-pressure environment, which should be, in my opinion, predominantly educational in nature as far as that first visit goes. And you want to make sure you establish a good rapport with your doctor and his staff, because these people are going to be taking care of you at the time of surgery, but also afterwards, and you want to feel comfortable that they're going to be committed to your well-being before and after the operation. And also, you know, you want to see what the doctor's results are like, and there's so much information available on the web today that you can really get a good idea of what people can do, because people put their best results up on their websites, because that's what's going to attract patients. And then the final thing is price. Don't choose your surgeon based only on price. Your surgeon, if price is an issue, should be competitively priced, but avoid the guy who's the least expensive guy in town. There's usually a reason that somebody is substantially less expensive than everybody else. And what I tell my patients here is save money on your shoes, not on your surgeon. So that wraps up our video blog for today. I hope you found it informative. Please contact me if you have any questions about this or would like to make an appointment.